Okay, so during Breast Cancer Awareness Month, it is really important to know all about what cancer is and everything that comes with it. So a great way to do that, there's a health series event that Baystate Health is actually putting on. And here to talk all about that, we got Dr. Holly Mason from Baystate Health, surgical oncology and breast specialist here. So Dr. Mason, welcome to the show today. Really do appreciate you coming on. So I guess first and foremost, what is this series really going to be about, and what specifically are you going to be telling the folks at home?
Well, thank you very much for having me. We're very excited about this new virtual series that we're doing, trying to cover really a broad spectrum of what we deal with in breast cancer care. So I'm the lead-off talk, and I'll be speaking about an innovative procedure called radioactive seed localization surgery. It's something we've been doing since 2010 at Baystate Medical Center. It expanded to Baystate Noble Hospital in June, and we're starting to work on bringing it up to Baystate Franklin Medical Center.
Wow, very good there. So what's the benefit with that? If you're going to be expanding it, it's obviously doing something.
Well, the standard prior to doing the radioactive seed procedures for patients who had tumors, whether cancer or non-cancer, that could not be felt was to have a guide wire placed into the breast. It was very uncomfortable for patients and could be dislodged and frankly made surgery difficult. So the radioactive seed localization procedure involves placement of this very small metal seed. It's much more comfortable for the patient, very difficult to dislodge, and allows breast surgeons to make much more cosmetically friendly or acceptable incisions, hidden scar type incisions, which in the long run is better for patients. So it's really enhanced the quality of the care that we provide.
Wow, that's impressive then right there. And speaking of the care, as a whole, where are you right now in the pandemic? Are you finding folks are hesitant?
We were initially concerned that patients would not be willing or comfortable coming in for care. That's not what we found. And so I think that Baystate Health has done a very good job at being at the forefront of working towards the safety of the patients and the staff. We take it extremely seriously, as patients have seen when they do come in. So we have not seen the hesitancy that we had feared.
All right, and then to get back to the series itself, just so folks at home know, this is something you can tune into right from your computer at home. So, Doctor, I wonder if you could just give them kind of an overview, because it's multiple talks going on here, correct?
Correct. So I'm giving the first talk this week. Next week, Dr. Michael Eunice from Radiation Oncology is going to be speaking about another innovative procedure using 3D modeling to provide radiation. The week following that, Dr. Danielle Lipoff, who is a breast surgeon in my group, as well as Dr. Casey Collins from plastic surgery, are giving a combination talk about the options of reconstruction in breast cancer surgery. And then finally, Dr. Jennifer Hadro is going to be giving a virtual speak screening mammography.
Well, this will no doubt raise some awareness for the horror that is cancer. Appreciate what you're doing for many people at home, Dr. Mason. So people just head over to Baystate Health to try to get organized with that on the websites?
Correct, and it's there's a registration button for each of the speeches, so it's fairly easy. I've actually checked it out to make sure that it was user-friendly. There
you go. Good stuff. And after the technical difficulties I've been having all morning here, it's great to hear somebody knows what they're doing. Doctor, thank you very much for coming on, and I hope the events go great, all right?
Okay, thank you, and thank you very much for having me today.
No problem.